Hi, I'm Dr. David Schechter. Today we're going to see a panel of patients who've been diagnosed as tension myositis syndrome and who've been through a successful mind-body treatment program. I brought this group of people together because I thought it would be important for patients who are going to go through this program to learn from some of the techniques and methods that successful patients have utilized in getting over their problems. Hearing their stories will help us to understand how people going through this process get over their pain. Let me tell you a little bit about my story. 23 years ago, I was a first-year medical student at NYU, and I was having knee pain, and it wasn't going away. My outlets were basketball and running, and I was finding that I was not able to participate in these activities. These were the hobbies I had that helped to burn off the tension and stress of medical school, and I really started to miss them. Because of the continued pain, I saw the student health doctors at NYU. They diagnosed it as tendinitis, and they recommended anti-inflammatory medications. I didn't get better. So the next referral was to an orthopedic surgeon who was the New York Yankees team doctor. And he examined me, did certain tests, and concluded that I should try another course of anti-inflammatory medications and leg strengthening exercises. I diligently did the exercises. My legs got stronger, but the pain didn't go away. So in desperation, I walked into the office of Dr. John Sarno, a physician who had lectured to us in the anatomy course. I knew that he specialized in physical medicine and rehabilitation, so I went in there hoping to get some specialized physical therapy treatment that might solve my knee pain problem so I could return to sports. What I heard that day not only changed the course of my pain, but also helped focus my medical career. Because when I told Dr. Sarno about my symptoms and the treatments that I had tried, his comment was, much of this chronic pain is actually psychosomatic. How do you react to that? And I said I was a little bit surprised to hear it. But he invited me to attend a lecture seminar that he gives to patients who've been diagnosed as TMS, or tension myositis syndrome. So I went to the seminar, and what he described to me that evening made a tremendous amount of sense to me in terms of my personality, kind of a worrier, in terms of the symptoms that I had, and in terms of a mechanism by which stress and tension could create or perpetuate physical pain, usually in the back or neck, sometimes in the legs, sometimes headaches or other symptoms. By the time I left that evening and went home, I felt like a weight was beginning to lift off my shoulders, and that weight was my fear and anxiety that my pain in my knees was not going to go away. Within the next few weeks, my pain was essentially gone, and I returned to running and playing basketball, and the pain gradually went away completely. This made me quite a devotee of this diagnosis and approach, and I shared it with medical students at NYU and with my professors as well. Many were resistant to the idea. Medicine is quite focused on molecular biology and on the aspects of science that you can look under a microscope and see, and not as concentrated or not as comfortable with psychological approaches and techniques. Nonetheless, I've continued to apply these principles in my practice, and now, years later, have developed my own approaches, techniques, and methods to treating and diagnosing tension myositis syndrome. What we'll see today is the results of those treatments and methods in listening to this panel of patients tell their stories of the pain that they had, how they were diagnosed, and what techniques and methods they used to get over the pain.
I was suffering from lower back pain. I had gone through every therapy I thought that there was, from acupuncture to injections. I didn't have, the only thing that I didn't get to was surgery, and that's kind of how it led to coming to you. I was taking Advil all the time, and it got to the point where I think I told you that I felt that it was a good day when I didn't have to use any Advil. And so I was very frustrated. I couldn't play basketball. I was limited on when I could ride horses, just doing some of the activities I did with my kids as well. I have 2 kids. I had been suffering from the pain for about 5.5, almost 6 years. The cost had gotten expensive because I was getting soft tissue or deep tissue treatment, and I was going there sometimes once, twice a week. Not only the cost from paying for the therapy, but actually from driving to the facility from my job and, taking time off work and just all the stress of getting through the traffic in LA. It was really just getting frustrating. Like I said, I had tried acupuncture, I had injections, I had pain blocks, I had taken anti-inflammatories, I had gone to a nerve specialist, an arthritic specialist, an orthopedic doctor. I had gone through chiropractors, and so it had really started to mount. If the MRIs and everything, it just tallied up, and it had just gotten to the point where I didn't know where else to turn.
What diagnoses had they given you at that point?
Well, it was mostly vague. Everything that they saw in the MRI showed that I was just normal, basically, for someone who had been as active as I had been. It's something that should go away. It's something that it's some deep inflammation, that if we just keep working at it, that we'll get to it. And most of the times, most of the reliefs, if they worked at all, were just temporary.
How did you first learn of TMS?
I came home one night and Dr. Sarno was on, I think, 2020. And I was like, wow. So I went out and bought the book, read the book, thought, this is pretty interesting, put the book down for about another 1.5 years or so, and then contacted Dr. Sarno's office. And he said that he didn't take anyone outside of New York, but he had a protege, and that was yourself, and that's how I got to you.
What sparked your interest in accepting an alternative viewpoint for pain?
Mostly because they said that nothing was really wrong. They really did say that, that there's probably this and probably that, but nothing that shouldn't be able to heal itself, so to speak. And when I wasn't healing, I just felt that, there's got to be another way.
What was your visit with me like the first time? And was there anything specific that helped you to believe or accept the diagnosis?
The first visit, I was a little apprehensive, just anxious, wondering, what's going to go on here. I would think that the biggest thing that I came to was when I realized that I kind of felt that there might have been some punishment going on internally. That that for some reason or another I felt I deserved this pain or something like that. And once that kind of came out, and that was through the journaling that we did, it seemed to make things move along quickly, and I started getting a feeling that things were getting better.
So for you, it took a little while to focus in on what the emotional issues were. Right. And once you made that connection, it was a lot easier for you to move forward from there.
Right, correct.
Tell me about your experience in doing the workbook. Was it easy for you to write in it every day? Was it challenging? How did you find it?
It was pretty easy. I had done things like that in the past. And what I did at first was I just wrote, just wrote what was ever on my mind, even if it didn't really seem to matter so much about what the pain was. And then eventually, after going through it for about 3 or so weeks, I started just jotting down little notes. And then in the meantime, or in the interim, I was also just chanting TMS. When I felt any pain, I just, I would almost literally just bombard it with the fact that it was TMS and there was nothing really wrong.
So it sounds like you used a little bit of a free association type technique when it came to your writing, and it used a little bit of sort of a thought blocking or a thought changing technique by saying to yourself that TMS phrase as a way of changing what you believe to be the cause of your pain.
Right. Actually, I use like a song. Like there's a commercial for an insurance company, and I just went TMS, TMS. You know, and it was.
So that was a good way for you to really get into your unconscious.
Right.
I mean, that was because we talk about developing a little phrase or a mantra in the term of meditation, and you came up with a little jingle almost.
Right. Right. And it seemed
Very
to help.
interesting.
I don't take hardly any Advil. That's one thing. When the pain, if the pain is strong, then I do go back to doing more journaling. If it's just something that's just a little flare up, I still kind of use the mantra that I was talking about, or the little jingle, and just I keep reiterating to myself that there's nothing wrong. It's just TMS. I think that the main obstacle that I have is just letting go and getting past the fear of that there was something wrong. And so other than that, it's been great to get out there and sweat that way. It's a different type of sweating when you're out there kind of competing on the basketball court than, say, if you're just riding a stationary bicycle, which I am also doing. My suggestion is that if you decide to put the book down, pick it back up one more time, because I think that to always look inside, that's usually where the answer is, even if, there is a medical problem, but to look inside, you can really understand yourself better, and that's important in life. So it would definitely help you, and especially if you've gone through a series of testing and so forth, and you're not getting anything accomplished.
Moving on to Carrie Beth. Now, Carrie Beth, your pain was actually not in your back. Back pain is probably the most common TMS pain syndrome that we see, but there's quite a few others. Tell me a little bit about your background and how you flowed into this program.
My background is in the film industry. I worked for years in feature film editorial. I was an editor and assistant editor, and I had a repetitive strain injury. I did have pain in my back, but it was mostly my upper back and my neck. And I had been diagnosed with something called thoracic outlet syndrome from computer overuse, because film editing is now all done on computers. So I would spend 12 hours a day on a computer. I had pain it basically went from the base of my skull down into my hands and into my shoulder blades and my collarbone. And my hands would turn blue periodically. I had nerve pain. They would tingle and buzz and burn. I had spasms in my neck muscles. I would wake up some days and I couldn't turn my head. And this went on for a long time. At the time I came to you, I had been unable to work for 4 years. I had been having symptoms for about 8 years. Yeah, it's a long time. And nothing else had made it possible for me to go to work.
So you had the willingness, based on almost frustration or desperation, to look at something different. How did you learn about TMS?
I belonged to a repetitive strain injury support group in Los Angeles. And one meeting, we would meet once a month. One meeting, someone brought in Dr. Sarno's book, Healing Back Pain, and said, this book is the greatest and people get better just from reading the book. And I thought two things. I thought, number one, my problem isn't back pain. My problem is repetitive strain injury, so how can that apply to me? And number two, oh, please. Give me a break. People get better just from reading the book. What a load of hooey. That's what I thought. And so I completely dismissed it. And I didn't think the whole idea of it made me angry. It made me mad. And I didn't read the book at that time. I just thought. And then about 6 months later, I got an email from someone I knew from this group. And I knew her. She had a really bad case. She was almost completely disabled. And she was writing me and saying she was better. She was 98% pain-free. She graduated from Berkeley with honors with this fabulous GPA, and she was going to go to graduate school, and I wanted some of that. I wanted to be better, and I had tried everything. It felt like blame. It felt like this book was going to tell me, it's all in your head. You made it up. You did it to yourself. It's your fault. That's what it sounded to me like. That's what it was going to tell me. The book, of course, doesn't say that, as we all know. But hearing someone describe it made me feel attacked.
What does the book say that you can sort of reassure people who might be watching this video and not that familiar with the diagnosis and treatment about the pain that is different from blame, although it does reside to some degree in how we think about things or our emotions or that sort of?
It is something that your body does to itself, but it's not a conscious choice. Mm-hmm. So there can't be any blame. Your subconscious takes over and says, well, this emotional stuff is so powerful and so threatening that we're just going to tuck it away. And it's going to come out as pain in your wrist, because it has to come out somehow. So it's not a conscious choice. So there is no blame.
Has there been a process of almost forgiveness as you've looked back at that past and kind of moved beyond it to a healthful state?
Yeah, actually, yeah, that's true. There has been. I found out, as I said, from a friend who had been to you, who'd read the book, who'd gotten better, and she gave me your name and phone number, and I read the books before I came in, and reading the books made me realize that, okay, this is probably a very sensible thing, and I'm ready to try it, and let's go. I came in and I brought this little packet of materials that I had collected over the years from all the different doctors that I'd been to. I had an MRI, I had several sets of x-rays, I had reports from different doctors, and there's a stack of them. There's a bunch of them, and I gave them all to you, and you read through them. I got a nerve conduction study. You did one of those. And in fact, you were the first person who did a nerve conduction study that included the thoracic outlet. In that many years, no one had ever done a nerve conduction study.
I think that's good pointing out, because it's not that I assume that everybody has TMS just from walking in the door. We do take whatever appropriate tests or imaging or nerve testing in order to assure ourselves that what's going on, while painful, is ultimately benign and can be handled in this manner.
I remember you did all of the tests that everyone else did for thoracic outlet syndrome. The what is this one? Adson's? That one. Yeah.
There's a patient who knows the medical training. He's ready to go on to medical school now.
I remember you saying to me, because what happens in an Adson's test is you lose your pulse. Your pulse in your wrist goes away, and you said, oh, you can turn it off like a little spigot, you know, when my head turns. So I had all the clinical manifestations of thoracic outlet syndrome. And I remember telling you that I wanted to trade in my TOS for TMS. Because people get better from TMS, but from TOS not so much.